In this first slide, we're going to spend a few minutes thinking about the different forms of social welfare programs. When we're talking about social welfare, we're generally referring to health programs, programs having to do with income support, and education programs. But we're going to be focusing mostly on the first. Now, when we talk about social welfare, your chapter in your textbook focuses on the federal involvement, which really didn't start until the 1930s with the first program, Social Security, set up in 1935. And this program was set up as a part of the New Deal package during the Great Depression. And it was really reflecting this new reality in the economy that had shifted away from rural areas and toward cities, and away from farm sustenance and toward wage labor. And this kind of economic situation leaves elderly people without really any means of support. And so Social Security was conceived as a system of providing retirement payments to elderly people who've stopped working. When it was originally passed in 1935, the Democratic Party was the party that passed it, and this is really initiating this new divide between the parties, with the Democrats arguing that the federal government should have a role in the economy and Republicans still being opposed to this. Today, though, we don't see a strong divide between the parties on the question of whether Social Security is a good idea or not. It's fairly widely popular among both Democrats and Republicans. The second major expansion is in the 1960s with Medicare and Medicaid in 1965, aid to families with dependent children, which was an income support for low-income families with children, and aid to low-income schools. And the third major expansion comes really in 2010 with the Affordable Care Act. There is also an additional Medicare Part D in 2003. You can see it's almost every generation there's a new expansion. Now, when we think about the different kinds of programs, we usually draw a distinction between social insurance programs on the one hand and public assistance programs on the other. Your textbook calls these the first type contributory programs because workers contribute to these programs in their paychecks through their working life and then are entitled to them when they retire, for the most part, or when they need them. The programs, these types of programs do not have a means test, which means that all income levels can receive them. And they enjoy, like with Social Security, fairly wide support. Some of the examples of these programs, Social Security is on your pay stub. It's called OASDI, Old Age Survivors Disability Insurance. Also unemployment insurance and Medicare, which on your pay stub may look like, might say HI for hospital insurance. Together, these programs are $1.4 trillion. This was in 2014, so they're higher than that now. And they certainly brought down the elderly poverty rate. The second main type of program is public assistance programs, non-contributory, which means that people don't contribute to these programs that are funded through the general revenue, and they are only given to people with low enough income to receive them. There's a lot less public support for these kinds of programs. They're kind of considered redistribution, but in a sense, all of these programs are redistribution. Social Security is redistributing income in a sense, away from people who don't live as long and toward people who end up living longer. And Medicare, same thing, distributes money away from people who manage to stay healthy their whole life and toward people who end up being quite sick. Some of the examples of public assistance programs include TANF, Temporary Aid to Needy Families, food stamps, subsidized housing, earned income tax credit, and together these are about $220 billion in 2014, substantially less than the other type of program. And two health programs are also public assistance: Medicaid, $300 billion, and insurance subsidies under the Affordable Care Act. These types of programs brought down the child poverty rate, and they also redistributed income away from wealthier states and toward less wealthy states. Now, I want to focus a little more directly on the health reform law. Now, it's the most recent of the large expansions of social welfare programs, so it's worth spending a little bit more time on. Now, in the health system, there are three major goals: low costs, high number of citizens with access, and good outcomes. And the U.S. has had a kind of a mixed record on these, which was really at the heart of the attempt to reform the health system in 2009-2010. For instance, we've had historically very high costs compared to other countries that are like ours. We spend 17% of our GDP on health. Other countries similar to ours average 10 to 11% of GDP. We also have had historically a lot more citizens who cannot get access to coverage and end up going without health kinds of treatment that they need, partly because the plans are too expensive, or because they had a pre-existing condition that made it so that insurance companies didn't want to sell them insurance. We've also had kind of a mixed record when it comes to outcomes, with certain kinds of things like 5-year breast cancer survival rates, where we do really well. But other kinds of things like infant mortality, we're behind every other advanced industrial country in the world, 30th. Even though our income is one of the top 2 or 3 in the world. Now, the Affordable Care Act, which was passed in 2010, was meant to address some of these problems. And I want to talk about 4 different aspects of this program. See 1, 2, and the next slide, 3 and 4 elements of the law. Now, the first part of the law, and some of these are social insurance type aspects, and others are public assistance. First, the mandate to purchase health insurance is a kind of a social insurance model. Now, when we use the term social insurance, we're talking about these contributory programs, but we're also referring to the idea that insurance itself is purchased in order to alleviate a possible risk. And insurance, of course, in order for it to be feasible, there has to be more people that pay more into it than take money out of it. And in a traditional insurance model, this is done at the level of the individual. So companies would sell you insurance if you were a good risk, if you were going to make money for them, and they would try and sign up people that had a good balance of low risk and high willingness to pay, which means that people who have a very high risk of costing money for the insurance company were left out. Now, a social insurance model takes this notion of insurance and brings it out to the level of the society, so that so social insurance, to the extent that the requirement to purchase health insurance was combined with the end to the pre-existing condition exclusion. So let me explain that a little bit. Insurance companies, when they were working on the traditional model of selling insurance to someone based on their own, that individual's risk to the company, if somebody had had an illness in the past, were not allowed, couldn't purchase health insurance. They were considered too high a risk. And so a lot of people thought this was quite unfair and unjust and wanted to get rid of it and require insurance companies to sell people health insurance. But if you require this of insurance companies without requiring that people purchase health insurance, you will end up with a situation where people will wait to purchase health insurance when they are sick. And in that case, insurance companies would essentially go out of business, because the only people who would be insured would be very expensive sick people. So in order to get insurance offered to everyone, you have to require that everybody buy health insurance. So this is essentially the shift to the social insurance model. Now, along with this, though, comes a public assistance part of the program, and that is the recognition that some people really cannot afford to purchase health insurance. And so there would be subsidies offered for households with a sufficiently low income, which is really in the middle income range. It's a fairly high limit. So that's the first part of the program. And then the second part of the Affordable Care Act is requiring employers to offer health insurance and having a tax penalty if they do not. So again, this is the social insurance model trying to bring all the different elements into the system. Now the third main part of the Affordable Care Act is the expansion of the group covered by Medicaid. This is as well a public assistance part of the program. Now, Medicaid, of course, is for low-income people, and it's been around since 1965. And Medicaid, as it was originally set up, was a fairly flexible program, so that some the states could tailor the program to their own state priorities. And so there were some states, like California, that had relatively high income limits, or income, caps to be able to get Medicaid. And other states, like Mississippi, had really low, so that in Mississippi you couldn't get Medicaid if you made more than $3,000 a year, for instance. Now, if someone is going to apply for health insurance and the federal government is going to pick up the additional cost, then for people who are extremely low income, this would mean that the federal government would essentially be picking up the entire cost of the insurance. And so the thought was, rather than do that, just shift those people into Medicaid and forego the insurance company altogether. So this was part of the law as it was originally passed. But the Supreme Court struck down that part of the law so that states are not required to do this, and it kind of blew a big hole into the coverage that was going to be covered under the Affordable Care Act, because people still can't get insurance help up to, unless their income is sufficiently high. And so there's some groups that don't have access at all. So here's a visual that sort of illustrates what we call the Medicaid gap. So Medicaid for some people up to a certain percentage of income, and in regular Medicaid that was $8,870 for parents in a family of 3. That was the maximum. And then the insurance subsidies don't kick in until $11,880. And so if you were somewhere in here, the original law was supposed to take this over here for every single state and make it the same for every state. But the Supreme Court struck that down, so that meant that there's this hole here where somebody makes too much to get Medicaid, but they make too little to get insurance subsidies. So it's pretty awkward, but that's what's going on. I'll just give you an example of the states. So some of the states, about 22 states, have decided not to expand Medicaid. California did under the law, and all the states that are in blue. And so, for instance, in these states, very low cap for Medicaid. In other states, higher. And here's the status with childless adults. Under the law, states were supposed to offer coverage to childless adults up to about $11,000 in income, and then these states did not. So if you're a childless adult in these states, you have no coverage under Medicaid. So that's kind of how it works. And then third, cost control measures, trying to bring down cost by requiring certain kinds of things of health insurance companies. Now, the Affordable Care Act, then, the kinds of things that has happened, in terms of access to coverage, certainly there was a decrease in the number of insured people in the country. No question about that. And uninsured went from 18% down to 9%. But there is that Medicaid gap. And there are issues about the costs of premiums and the size of deductibles and whether those things are limiting access. Whether some employers are shifting employees to part-time in order to avoid having to provide health insurance. And some have estimated that maybe between 500,000 and 1 million workers might be in that category. And also the issue of narrowing networks and the difficulty of finding a doctor under this new framework. But some of the things that have happened, for instance, most people still get insurance through their employer, and they're not affected by this. They weren't affected very much at all by the law. People who were getting insurance not through their employer before the Affordable Care Act, those are now getting insurance through the exchanges and in an unsubsidized way, many of them. So they have to pay the full cost of the insurance. And these are the ones that are particularly affected by recent stories about premium increases of 25%. Really, that's the only group that's affected by this. The subsidized group, their premiums might go up, but so would their subsidy, so they're not affected. It's these people who are affected, and it's a fairly small percentage of the insured population in the United States. Medicaid, of course, the number of people covered under Medicaid has gone up. Medicare has gone up as well. There are more elderly people, and those numbers are continuing to go up. So we've had some changes. As far as costs under the Affordable Care Act, inflation is, for the first few years, was pretty steady, but there was a recent spike of about 5%. Inflation, it's really, the story is still pretty unclear about this. We also find that people who had pre-existing conditions and couldn't buy health insurance in the past, who for the first time have coverage under the Affordable Care Act, are pretty expensive. And this is part of the reason that some of insurers have dropped out of the exchanges, leaving remaining insurers facing no competition or less competition. And so this is part of what's driving premium costs up. And so, like we've said, very high increases for that small group of people in the unsubsidized market. There are modest increases for people in the employer market, probably most of which would have happened even without the Affordable Care Act. The federal budget as a whole is pretty much in line with the projections that were given when the law was passed. So the subsidies this year of about $32 billion, that was pretty much what was projected when the law was passed. So it hasn't been an enormous budgetary surprise. Lots of questions about where the Affordable Care Act should or could go from here. Some kinds of the reforms that have been suggested. Most everybody agrees that there are sufficient problems with the Affordable Care Act that something needs to be done. Any major social program, any major piece of legislation in general always needs tweaks. This kind of process is not perfect. And part of the problem is that there is such a gridlock in Congress right now that it's almost impossible to pass any of the fairly simple changes that might be made to improve the law. Some of those changes have been suggested in providing what's called a public option in those markets where there is only one provider or maybe two and costs are going up, to allow people to shift into Medicare if they like. So bringing down the age to 60, for instance, so that people could go ahead and buy into Medicare. Also finding ways to increase the numbers of those who purchase insurance so that the pool will grow through increasing the subsidy to people or increasing the tax penalty. And also finding a way to get rid of the Medicaid gap. Another suggestion, of course, that's been made and tried many times is to repeal the act altogether. And in that case, you'd really be throwing out the good with the bad. Suggestions for replacing it, some on the right have suggested replacing it with a more market-oriented system with health savings accounts, cross-state competition, and basically returning to a time when a lot of people didn't have insurance, with the thought that this might give more people the incentive to work harder or work more or whatever. Other more dramatic suggestions, switching to a single payer system, like we have in the UK or Canada, maybe Medicare for all. And another model is the nonprofit insurance model that you find in places like Germany. So these are some of the suggestions, all of which would require major legislating, which is pretty difficult right now in the gridlocked Congress. So these social programs, when it comes to the federal budget, the largest three, Social Security, Medicare, and Medicaid, right now make up about 50% of the entire federal budget, most of which is mandatory spending, as I mentioned before. And the demographics of these programs in particular are problematic. As the population ages, it's clear that these programs are going to have a lot more beneficiaries and fewer contributors to fund them. The programs are set up on a pay-as-you-go basis so that current workers pay current retiree benefits. Social Security, for instance, in 1950 there were 15 workers for every one retiree. In 2015, only 2.7 workers per retiree, and that number is going down. This is relatively easy to fix if you were to raise the taxes or retirement age. Medicare is quite a different story. It's clear that the current revenue stream is not enough to pay for the promised benefits. We see, for instance, many people or the situation right now where people are paying in many fewer taxes than they are taking out in lifetime benefits. This is a study from the Urban Institute, 2013. A single male earning an average wage in 2013. If he were retiring this year, he would have paid in $407,000 in taxes and taken out $484,000 in benefits. That's the best scenario, and it gets worse. A couple, or a single female, would have paid in $407,000 and taken out $544,000. A one-earner couple paid in $407,000 and is taken out $910,000 in benefits. And it gets worse as the wage goes up. So here's somebody who, a high wage earner, paid in $582,000, took out $1,024,000, almost double the amount they put in. This is not sustainable long term, of course, so we got to figure this out. Clearly, we're going to have higher costs with Medicare as people live longer with chronic illnesses. Right now in Medicare, 14% of the recipients use 48% of the benefits. And as healthcare costs continue to be unpredictable, this makes it difficult to figure out how much to budget for these programs. It's a lot more difficult to fix. Now, another set of issues that we follow when we're thinking about social welfare are questions of poverty and inequality. We track these things. The poverty threshold, we have a measure that is $23,850 for a family of 4 is the threshold, and families making above that are not considered to be in poverty, and below that are. So, certainly if you are living in San Diego and making $24,000 and you're a family of 4, it probably feels like you're living in poverty, but this is a one-size-fits-all measure. And this is what the poverty rate is based on. In the U.S., about 15% of households have income below this. About 20% of children live in those households. African Americans, Hispanics, higher incidence, in whites, 10%. We also keep track of inequality of income and wealth. And those are often measured in terms of quintiles. Highest quintile, lowest quintile, 20% of families, next 20% of families. And it's clear that since the 1970s, the top quintile's share of income and wealth is increasing. Here's a chart that got a lot of attention on this issue. This is a measure. This is 20% of families, next 20% of families, next 20% of families, all families altogether. 1979, 2007, and it's the share of the income pie. So if you were to add up all of these bars here, you get the total income, and then total income here. And this is the share of the income, and it's clear that every quintile group has a lower share of the income now, except for the highest. And especially the top 1%, their share of the total income pie grew by more than double. And the way to think about this is the share of the income pie. This is not income in general. So income for these groups did go up a little bit, but income for this group went up a lot. We also pay attention to questions of inequality and how that affects economic mobility. Now, let me just make this a little bigger. This is a measure of economic mobility. Inequality here, what we call the Gini coefficient, ratio of the top to the bottom, and intergenerational earnings elasticity. So this is the going up this way, more unequal over here, and the higher you go up, the more likely it is that someone is going to be staying in the same income group they were in when they were children, for instance. And so the assumption here is that the more equal the society is in terms of income distribution, the more likely it is that one might move from one income group to another. Here's the U.S. right about the middle here. And this is some measures just from the United States. These is the groups of 20% of the household families, household income. And this is the percent of adult children that are in the same income group they were in as children. So, for instance, this is the smallest, lowest income group, and 43% of the people that are adults in this group were also in this group as children. And 4% managed to move up here, right? And the same thing from the other end, 40% of the people in the top income group were there as children as well. And 8% of the top income group managed to move down. Now, the reason we pay attention to this kind of measure isn't, well, I mean, one might say, well, that's not fair or whatever. But from a standpoint of economic efficiency, if you're going to have an economy that is good at rewarding good behavior and at doing the opposite for bad or inefficient or bad behavior, it wouldn't look like this, right? One would expect all of the boxes to be about the same size, so that there's, 8% of this group, for instance, you might consider screw-ups or whatever. There's no reason inherently to think that there are more kind of screw-ups in the bottom income than there are in the top. Certainly, there's not a genetic reason that you would expect there to be fewer screw-ups among wealthy people. But certainly when you think about access to education, services, borrowing, it's not surprising that you'd have this stickiness in the top and at the bottom. And for an economy, that's a problematic thing. And so questions about why there is, we see these measures of income and wealth inequality. Well, certainly one answer has to do with tax policy. It's clear that tax policy has gotten less progressive since 1979. That's when we started lowering taxes on the wealthy and on investment income. And that's also when we started setting up tax policy benefits to go to upper income people more than lower income. So for instance, the mortgage interest deduction is much more available to high income people than low income people. I'll just give you some visual on this. These are what we call tax benefits, ways in which the tax code gives benefits to groups of people through, for instance, lower taxes on investment income, that's this column, itemized deductions for mortgage interest and things like that, that's here in this column, tax credits like the child tax credit, that's this column, and this is the 80th percentile income range, and this is the size of the benefit, the dollars essentially, and where it goes. So this is the type of benefit, and the blue is the size or the amount of these kinds of benefits that go to the top 20% of income households. And these are the benefits that go to the bottom 80% of households. And you can see that there's a lot more blue than there is brown, even though this is 80% of households down here. So the tax code certainly benefits high-income people. And we've seen that without a doubt with Trump's income tax situation, which is probably one in which he paid zero income tax for many years. And this is partly because of these kinds of tax benefits that we're talking about here. Another kind of reason that has been given for this difference is the productivity. Productivity gains seem not to be resulting in income growth over the past few years. So here's productivity. That's the amount of stuff that each worker produces, and these are wages. And so that gap here must be going somewhere, and it is going into the households of the wealthy people, right? We also see a decline in unions, and some people have speculated that this is to blame partly for income inequality. Let me just show you this decline in unions. You can see moving a little ahead, we get to a point where many states, very few workers that are in unions over time. This is the fading away of union membership, and unions are the main force to negotiate for higher wages. Another kind of answer has been given by McCarty, Poole, and Rosenthal in the reading that was on the syllabus for this week. McCarty, Poole, and Rosenthal are wondering why inequality keeps going up. Especially in a democracy, one would expect that there would be pressure to redistribute income, especially if the benefits are going disproportionately to a small group of people. When they begin to ask this question, they notice a correlation between income inequality, polarization in the Congress, and percent of the population that is foreign-born, right? So income inequality, polarization in Congress, and percent foreign-born. And they want to know why that is. And in their arrangement of the data, they come up with a couple of answers. One that they call the disenfranchisement effect, and the other they call the sharing effect. And let me just try to illustrate this a little bit. Here are all the income groups. These are the households distributed, top 20% of households, bottom 20% of households, and in between, right? This is their median income. That's the midpoint of income for the people in that group, right? And this is voter turnout for those ranges. Now we know that voter turnout is much lower in lower income groups and much higher in higher income groups, and these are the numbers here. Now, from their standpoint, economic theory would predict that as the gap between median household income and average household income grows, that voters are going to demand more redistribution. So median household income is the midpoint right here, right? 56,500. And that's the point at which there are 50% of the population this way and 50% of the population that way, right? Now, average household income is higher, and that's because there's so much more income up here. So average income, if you take all of the different households and take their average income, you get to 79,300, which is up here, right? And so the idea is that as the gap between these grows, which it has been since the 1970s, one would expect more pressure to redistribute. But one of the things that they notice is that in that spot right here, where you have 50% of the population here and 50% of the population here, what you find is that you have 43% of voters on that side and 57% of voters on that side. So they started thinking about, well, what is the median voter income? And the median income of voters is much higher. 79,800 is the number I came up with with more recent data. And that is the point at which you have 50% of voters on that side and 50% of voters on that side. But you only have 45% of the population on that side and 65% of the population on that side. Sorry, I had to fix that real fast. You have 65% of the population on that side and 45% on that side, right? Smaller number of people this way as the income goes up. But you're right in the middle of the voters. And the average voter income is $88,655. And the gap between median voter income and average voter income is much smaller, only $8,000, than is the gap between median household income and average household income, which is $22,800. So for these authors, that would kind of explain why there's not as much pressure to redistribute as one would think there would be, given the median household income and how different that is from the average household income. So this is what they call the disenfranchisement effect. Low-income people vote less, and non-citizen households who cannot vote tend to be low income. So that skews where where the kind of the middle is, the middle of the voters. They also posit what's called the sharing effect, which is that the median voter kind of turns against redistribution because the large number of poor non-citizens reduce what the median voter can gain from redistribution. So if we go back to this slide here, the median voter is trying to figure out, okay, who do I align myself with? Who am I going to share with? And they look down and they see 65% of the population down here that doesn't have very much. And they're thinking, do I want to share my income with all of those people that have very little? Or do I want to kind of look up and I see only 45% of people with very high incomes? And so they align themselves more with this group than they do with this group down here. This is what he calls they call the sharing effect. Now, this kind of effect also produces, it was related to the polarization that you see in Congress, right, with the different wings of the party producing policy gridlock, which means that it's very difficult to represent those other citizens. And some people have looked at this, have asked, well, what if the median voter income shifted downward? And if you think about that, what would make the median voter income shift downward? Well, one thing that might make the median voter income shift downward is if more people voted down here, right? If their turnout were as high as everyone else's turnout, this would shift to the left, and the gap would be greater, and one would expect more pressure for redistribution. So this picture gives us an idea of what kind of dynamics are involved in the politics over who gets to vote and how income gets redistributed because of that. Here's another image of this. This is the distribution of household income. These are the numbers of families that have income at this level. So between the 10th and the 50th percentile, lots of people. And then as income gets higher, of course, very, very few families. So median income is here, median voter income is here. Right? Now the last posited reason for the inequality is simply that a lot of people just really are not really aware of it. And this is a study that got a lot of attention in 2011. And they asked a lot of people this is about wealth, not income. What do you think the ideal distribution of wealth should be? And this is what people said. They thought the ideal distribution should be with the top 20% here, next, next, next. This is what they thought it actually was, right? Much less, much more unequal than the ideal, but you can still see this little sliver down here, the bottom 20th percentile. But this is what the actual wealth distribution is, with the top 20% owning somewhere around 85% of the wealth. And the bottom two, you can't even really see here. Their sliver of the wealth is so tiny that you don't get to see the bottom 40% of wealth distribution. It's a very simple, certainly a very simple idea that people simply are not aware, and that helps to kind of perpetuate inequality. All right, so hopefully this is gave you an account of some of the issues involved with social policy and social inequality as well.